A very good morning to everyone who is watching us right now. My name is Tony Areo, aka Mr. Twa, and today I have a very, very special guest with me that is going to share with us his purpose of being here. Otherwise, you're most welcome.
Thank you, Mr. Twa.
Kindly introduce yourself to the people who are watching, and then you tell us why you're here with us today.
Yes, a very good morning. I am Omiyo Charles Emi. Most people don't call me Dr. Charlie. I am a dentist by profession. I'm based in P1 Medical Center. I work in P1 Dental Clinic. We are just opposite Christchurch Primary. Thank you for the visit, Mr. Twa. I'm so glad that today I will discuss with my followers about toothache. I think this is the commonest thing that most of our patients come complaining about, toothache. Now, toothache is basically having a painful tooth, which can be in any part of the jaw, left, right, upper, or lower. Sometimes it comes with swelling, but sometimes it doesn't. They don't have swellings. Now, we have a number of causes, the number of factors which cause toothache. Now, toothache is basically caused by one main problem, that is dental decay or tooth decay. Now, toothache ranges from sensitivity to real toothache, where a patient comes and tells you, you know what, doctor, I didn't sleep at night. Now, depending on the level of the toothache, there are different solutions. Now, a tooth has about 3 layers. The first outer layer is called the enamel, which is seen and it is whitish in color. Now, after the enamel, we have what is called the dentin, which is the second layer of the tooth. And the third layer is called the pulp. Now, once you have a decayed tooth and the decay is only on the enamel, sometimes you don't have any pain because it is the outermost covering of the tooth. You may have a rough experience for in case your tongue rolled that side. But once you reach the second layer of the tooth, which is the dentin, you feel some sensitivity. More especially when you're taking cold water, warm water, or something sweet, you'll feel that sensitivity. And once it exceeds that, it will reach what is called the pulp, which is the third layer of the tooth. Now, in the pulp, you have the living tissues, which involves the nerves and the blood vessels. Now, once tooth decay reaches the pulp, it is medically termed as pulpitis. Now, this presents with serious pain. That pain may not even make you sleep at night. Now, you see a patient comes in and will tell you, doctor, you know what? I failed to sleep tonight. That's called pulpitis. Now, we have different treatments for all these toothache. Now, once the problem is only in the outer layer of the tooth, which is the enamel, we can just advise you to change the toothpaste that you're using. You can just give your toothpaste therapy, or we do what is called a sealant. We cement that decayed part of the tooth. Once it reaches the second layer of the tooth, which is called the dentin, you experience pain, but the pain is on and off. When you take cold water, you feel some pain, but in about 5 minutes, the pain disappears. But once you give it time, it will progress the more until it reaches the living tissue of the pulp. Now, at that stage, at the second layer of the tooth, we do what is called a permanent filling. We fill that tooth so that we avoid the outside environment from affecting the inside environment, and by doing so, you won't feel pain anymore. But once toothache reached the third layer of the tooth, which is the living layer, that's pulpitis and in the pulp, we have 2 basic treatments that we can give. One is called a root canal treatment. Now, in a root canal treatment, we remove the nerves and the blood vessels, but we don't remove the tooth, and we cement it back. By doing so, we would have killed that tooth, but it is there. It's like a false tooth. You use it for eating, for chewing, for doing another thing in the mouth, but it will no longer be alive. And the second option is when all the other treatments have failed, then we can do what is called a tooth extraction, of which most people think that the basic and the first primary treatment for toothache is extraction, but basically no. That's the last treatment we give when all the other treatments have failed. I think basically this is all I can discuss with you this morning about toothache. For more information, anything regarding the teeth, you can find us at the One Medical Center, at the One Dental Clinic, opposite Christ Church Primary School, Juba Road. Thank you.